Hey guys, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. I'm getting over a pretty nasty cold. I actually sound a lot worse than I feel. I don't actually feel that bad, but I sound pretty bad. So hopefully this video is worth your time, and it's a question I got. So first of all, if you're brand new, welcome. Make sure you subscribe to YouTube, subscribe to the blog. You don't want to miss out on when I launch new projects that you may be interested in, or when I just do giveaways. So subscribe to the blog, subscribe to YouTube. And for those of you who don't know how this works, you can send me a question. I'll keep you anonymous unless you specifically ask me not to. And you can either email me, dan@theclinicaltrialsguru.com. You can text me, 949-415-6256. Or you can find me on every single social network, whatever you're comfortable with, okay? Even Snapchat. I love Snapchat. I just had a video on what I think is the first patient ever recruited from Snapchat. Actually happened at one of my sites. And it may not be the first one ever, but these things are not recorded or tracked. But from what I've heard, it's the first patient recruited from Snapchat. So anyways, today's question comes from someone who is asking whether your PI, your principal investigator, needs to be board certified. And look, the answer is, it goes back to simple, fundamental economic principles. Supply and demand, okay? In short, the answer is no. I've never heard of a case where a PI must be board certified. There might be some studies out there where the sponsors are requesting only board certified principal investigators, but this is the exception, not the rule. You're always going to find exceptions. Of course, they prefer board-certified psychiatrists because a lot of these sponsors live in the academic world. They live in the world of academia, and board-certified is a little more prestigious. But from a practical perspective, private practice, physicians seeing their patients in the office, I mean, many of them are not board-certified, and that doesn't impact their ability to recruit, follow GCP, follow a protocol. They're still doctors, okay? So you don't need to be board certified. But back to simple economic fundamental principles, right now, it's all about supply and demand, right? Right now, we're in a period of time in our industry, May 2015, for those of you watching in the future, welcome. Right now, there's low inventory of studies. What does that mean? That means sponsors can be a little more picky with the sites they choose. So maybe they will only require board certified principal investigators right now. But I can assure you that this is not a requirement. This is not a formal requirement that I've seen or heard from any sponsors. But since we have a low study supply at the moment, sponsors can be a little more choosier about which sites they work with. So, I mean, I've seen some requests lately that I've never seen in the past. And sponsors realize that they can use the limited supply of studies to their advantage because they have a lot of sites out there competing to participate in the same trials. Now, hopefully the tide turns and we're going to enter a period where there's a lot of studies, which I'm hoping happens towards the end of this year and early on into 2016, where there's just a huge influx of studies, and then the sites can be picky about which studies we choose to conduct. I've lived through this back in 06, 05, a little bit of 07 and 08, where it was a huge supply of studies. Sponsors were practically begging you to do this study. So the tide turns all the time. Nothing stays constant in any business, especially not clinical research. Or I shouldn't say especially, but clinical research included. Okay, so it's all about supply and demand. But no, your PI does not have to be board certified, right? Hopefully this helps answer your question. Thank you guys for bearing with me with my voice, and stay tuned for more. Dan from theclinicaltrialsguru.com. Take care.
Yeah.